We will lobby for a return to the term assistant and not associate. We will continue to argue for the implementation of the BMA's safe scope of practice and supervision guidance for doctors. And locally, nothing is off the table. We will not back down in our call for a halt to any further recruitment of MAPs until the medical profession's concerns are fully addressed. If others won't lead, we will. Today, I want to announce that we are taking legal action against the GMC.
BMA Council Chair Professor Philip Banfield announcing legal action against the doctors' regulator, the General Medical Council, over the way in which it plans to regulate physician associates, plans which the union says will mean a dangerous blurring of lines for patients between highly skilled and experienced doctors and assistant roles.
When you last went to the doctors, are you sure you saw a GP? If you'd in fact seen a physician associate, would you know how they differ from a doctor?
Physician associates are being permitted to take on many of the roles doctors have traditionally fulfilled. The NHS employs more than 3,000 physician associates in England and plans to increase this to 10,000 by 2036.
I think there is confusion about what these staff are doing, because not only are they being labelled as physicians or specialists, but they're clearly undertaking tasks that are inappropriate for their level of training. And that goes to the very heart of the matter, in that no one has defined what these staff can and cannot do. We asked 18,000 doctors what their experience of these medical professionals were, and 87% of them said that they were witnessing practice that was putting patients at risk.
Who is getting, if in your view physician associates are doing jobs that they shouldn't be doing, who's deploying them in those inappropriate roles? Who's overreaching here?
This is the hospitals themselves. In the case of physicians associates working within general practice, it's NHS England who have been using a scheme called the Alternative Roles Reimbursement Scheme that is paying GPs to take physicians associates and preventing them from hiring GPs. So we've got this perverse situation where we have 85% of GP locums in England not able to find work.
The Department of Health and Social Care's project to rapidly expand medical associate professions, the largest group of which are termed physician associates, has left many doctors aghast. The plan itself has been described as one of the most singularly dishonest, duplicitous and downright reckless political responses to the NHS workforce crisis.
Unlike doctors who study for up to 7 years, physician associates only require 2 years of study.
The Royal College of GPs has also called for a halt to the recruitment of physician associates in general practice following a consultation with over 5,000 GPs. The college says its survey found more than 80% believe the use of physician associates in general practices has a negative impact on patient safety. The disturbing results also showed half of respondents reported being aware of specific examples of patient safety being compromised by the work of physician associates, including instances of misdiagnosis and inappropriate prescribing. Shadow Health Secretary Wes Streeting has backed the use of physician associates, despite doctors' warnings of a disaster for patient safety.
Where these roles can add value, and why I wouldn't throw the baby out with the bathwater and just say, right, well, let's do away with them, is, we do have a chronic workforce shortage. There are things that only doctors can do. There are plenty of things that only doctors should do. And if we can get some well-qualified people with appropriate training in to provide assistance to those doctors, to help doctors to work to the top of their licence, to help plug some of the shortfalls and to modernise the workforce. I don't have a problem with that. Where I do have a concern and where I am not relaxed or complacent is around substitution and risk to patient safety. These aren't substitutes. They should be additional. They should be providing additionality. And I think that's where it's going fundamentally wrong.
Mr. Streeting recently told Mail Online this: physician associates working within their scope of practice have a really important role to play. But one of the key issues is that unlike every other profession in the NHS, all of which are regulated with a national scope of practice, the GMC is proposing that physician associates uniquely have their scope of practice set locally. It's completely mad. It would allow cash-strapped trusts to sacrifice patient safety for cost cutting. Now, alongside the BMA, Anaesthetists United, an independent group of grassroots anaesthetists, are planning separate but complementary legal action which relates to the lack of national regulation of scope of practice for physician associates and anaesthesia associates, a vital issue which the GMC has studiously avoided. And let's not forget the physician associates themselves in all this. These are real people who work incredibly hard and care about the patients they work with. Through no fault of their own, they've been put in an impossible situation, one which is causing many of them huge amounts of distress and anxiety. This situation needs to be resolved for them as much as for doctors and patients.